Hi, I'm Dr. Brian Rodgers. I'm the medical director at Longevity Medicine. I have been practicing medicine for over 25 years. I have been doing functional medicine for over 15 years. I enjoy my job. I enjoy helping people. I love to see people get better. I love being part of people's healthcare journey. I went into medicine the same reason why a lot of people went into medicine. I like helping people. I like to help people get better. That's just something that's a part of my personality. And in medicine is a job where your whole job is to help people go from illness to health. And that's kind of why I went into it. But as I practice medicine, I realized that some of the things don't help people get better. They help people maintain the disease that they're in. And so while practicing medicine, I kept on looking for better and better ways. For example, if people get diabetes, most traditional physicians don't help people get better. They help people maintain in their diabetes and put off their symptoms and adverse conditions, but they don't ever really reverse the diabetes. I went into functional medicine so that I could learn how to reverse diabetes, reverse disease. One thing I'm very interested in is diseases that cause chronic fatigue, muscle pain, and such. And I love reversing these diseases and seeing people get their lives back. Chronic Inflammatory Response Syndrome is a relatively newfound disease. It's been studied since about the year 2000, maybe 1999. And what has been found is to get CIRS, you have to have two things. You have to have a genetic predisposition, and you have to have an exposure to a toxin. That toxin can be mold, bacteria, things like Lyme disease, COVID, brown recluse spider bites. It can be toxic exposure to toxic fish, even algae blooms. When you get exposed, CIRS gets turned on, and you may go away from whatever started the CIRS, the mold or whatever, but the CIRS keeps on going. You asked about the symptoms of the CIRS, and that the number one symptom is fatigue, followed by brain fog. You can get body and muscle aches, joint aches. A frequent symptom is obesity, where you all of a sudden gain weight real quickly and can't lose it. Frequent urination, static shocks when you touch a doorknob or other things more so than normal, watery eyes, food sensitivities, abdominal pain. These are some of the more common symptoms of CIRS. CIRS is unique in some of these energy-sucking diseases is in that there are definite labs to test for CIRS. Some of these energy-sucking diseases, like chronic fatigue or fibromyalgia, they're diagnoses of exclusion, meaning if you don't have this, you don't have that, you must have one of these diseases. CIRS is unique in that way is that there are certain lab tests. There's a couple screening tests, a questionnaire that's been medically validated, and a visual contrast study. These are screening tests, and if you fail both of these, you have a 98.5% of having CIRS. But how do you know for sure that you have CIRS? Well, first of all, you have to have symptoms similar to other people that has been listed in the medical literature. Then you have to have lab results that are consistent with CIRS, as is reported in the medical literature. These labs are genetic testing. There are also some neuropeptides like VIP, MSH, MMP9, trans factor beta 1, and VEGF. If these are off, that could indicate CIRS. Also, you can check some complement factors like C3A and C4A. If these are off, you could have CIRS. Also, we look at other labs that are often off with people who have CIRS. Antidiuretic hormone, cortisol, ACTH, osmolality. We also look at bleeding factors and clotting factors. We even look at anti-nuclear antibodies that is often looked at for autoimmune disease. My most important advice for health is, first of all, it's going to be okay. Don't stress. Try and reduce your stress. How can you do this? Meditation, relaxation, My favorite thing to do is to go for walks in nature. Doing these types of things helps reduce your stress, reduce your cortisol, helps your body function properly. Exercise every day. You don't have to do a lot. A simple walk will help quite a bit. Eat healthy. Stay away from sugar, processed carbs, processed foods. Eating healthier, more vegetables, more fruit, these things will all help you to live a happier and healthier life. Earlier on in my career, as I was learning functional medicine, I was all excited to go to a nutrition course. This was done by Drs. Gabby and Wright, and they are the gurus of nutrition, supplements, and such. They knew everything, and I was excited to get to this course. It was a 3-day course, Friday, Saturday, Sunday course, and I couldn't wait to learn everything from them. And I got to that course, and while I was there, I did great in the morning, but after lunch in the afternoon session, I couldn't stay awake. And this is something I had paid a lot of money for. I was staying in a hotel. I had to have airfare. So I paid a lot to get to this course. And I could not stay awake to learn the things that they were teaching. I learned I had to stand up in the back of the room in order to see what was going on. Well, I realized at that time my thyroid is off, and I fixed that, and it helped some, but it didn't take care of everything. And later on, I was sitting in another course, and it was given by Dr. Andrew Heyman, and he was talking about CIRS. And this was a new condition that I had never heard about. But he talked about symptoms, as I've talked about previously, and I had a lot of those symptoms. And as I did the testing, I realized I had a lot of those tests that were off. And as I started following the treatment for CIRS, things started getting much better. And it turned my life around. And because I became much healthier and had much more energy, and my brain fog was able to go away, that's something I want to do for everyone else. I love helping people get healthier, to have their energy back, have their brain function come back, to feel better, to get rid of their chronic disease. I love for that to happen for them. My belief of longevity medicine, obviously we want to have us live longer and live healthier. But we can't do that if we have disease, chronic illness. And so my first step in longevity medicine is to reverse those illnesses, those chronic diseases, to get us to a state of health. My second step is to prevent things like heart attacks, stroke, and Alzheimer's from happening. And to do that, we do some testing, we do some lifestyle alteration and such to help get rid of our risk factors for these diseases that kill us early on in life, again, like heart attacks, strokes, Alzheimer's, and other things. Once we have those two steps done, then I go into what is traditional longevity medicine, where I look at different supplements, health biohacks, and such, where we try to improve people's health span, help them to feel healthier, and people's lifespan, help them to live longer. It's no good to live longer if you're not healthy. And so we want to make sure health is a big part of this. And so that is how I would like to approach the problem. I think if you only approach it from health span, lifespan, and ignore those other things earlier on, reversing disease and preventing chronic disease and preventing those things that kill us, we're missing 2/3 of the problem. I've seen a lot of CIRS patients, and I have a lot of colleagues that have seen a lot of CIRS patients. It is not unusual for a CIRS patient to have seen 10 physicians and spent over $100,000, and they're not any better. And a lot of times these physicians say, it's all in your head. But the problem is those physicians are missing information in their heads. Because I have seen these people who have had the chronic fatigue, the anxiety, depression, joint pain, muscle pain, abdominal pain, all these types of things. And there is a cause, and it's been well studied, and there is a treatment, and it's been well studied. And I say to these physicians who say it's all in your head, there's no cure, they just haven't studied long enough. They haven't studied in the right areas. And it's in their medical journals if they would just read them. I've helped tons of people who have been told you can't get better. And I love seeing them get healthier, get their minds back, get their energy back. And that's something we do here at Longevity Medicine. If anything we've said today rings home with you, or if you'd like to contact our clinic to see if we can help you or your friends or family, you can contact us at our website at lmthrive.com. You can call us at our phone number, 385-243-1615. You can stop by our office in Woods Cross at 1414 South, 600 West. However you get a hold of us, we would love to help you, your friends, your family. We want to give you your energy back and take away your brain fog.